Well, I'd like to welcome Jessica Bush to the Resilient Biome podcast. Thanks for joining us today, Jessica.
Thank you so much for having me.
I should say this morning for you in Tasmania. So extra thanks for getting up so early to join us.
You're
So
welcome.
our theme today is looking disease in the mouth, the oral gut systemic health connection. And Jessica is a naturopath, nutritionist, and herbalist with Necelium. And we would love to hear, we really want to get into primarily looking disease in the mouth, as we said, the oral microbiome and its relation to systemic disease. But we'd love to hear anything in your background you want to share that you think would be helpful for us to know.
Yeah, sure. I guess why I became a naturopath is looking at that big picture view on health and understanding how the body is functioning and how to work with it, and looking for, I guess, information as to how to improve the functionality of the human body. And so I've always been interested in health, and I found it a little bit tricky to find my path because going into, oh, do I want to work as this or do I want to work as that? I thought that's kind of not working with like the I guess the core reason why some of these things are going wrong. It's amazing and it's helping people at various stages of their health journey, but I really wanted to get to the underlying factors. So I studied naturopathy. And through that process of studying naturopathy, I learned about the human microbiome and how that impacts on our health and well-being. And I thought, wow, if I'm going to understand how the body works and how to piece all of this together, I now have to learn all about the microbiome and how that works, because we're more microbe than person. So to treat the whole person, I now have to treat the microbiome as well. So
And
I
that's, sorry if
pursued
I can interrupt, but that's
a
where,
gas. Sorry.
oh yeah, sorry, we had a little delay there. I was just gonna say that's where the lights start going off, right? You're putting the pieces
Mm,
together and you're like, oh my goodness. Which I hope we'll have some oh my goodness moments today as we keep talking. So apologize, keep going.
no, that's okay. I worked in a gastrointestinal fellowship, so I worked with clients from all over the world. After I graduated, I worked as an associate and senior associate within that, and worked extensively with gastrointestinal and microbiome related conditions. And I'm very thankful to all of the clients that helped me learn more about their cases and the microbiome in that process as well. And yeah, now I'm here.
Yeah, fantastic. Obviously, when you start with that as a background, you start to see very quickly all the other axes that are related to oral microbiome, brain, skin, all of that. So, yeah, for sure. So you are part of a business called Necelium, and is this your own private business then?
It is, yes. So Necelium, I guess, is my naturopathy clinic where I treat or I support people and their microbiome. So I wanted to create a space where um, I'm practicing naturopathy, inclusive of the microbiome as well, and to really focus on that as part of that business.
Oh, gotcha. Yeah. So help us understand, if I had this correct, would being a naturopath be sort of under the broader category of functional medicine? Because you're both shooting for the root causes. So how would you distinguish yourself from a typical functional medicine person?
That's a great question. I guess naturopathy, you're looking at those underlying principles that have carried throughout the history of naturopathic medicine. So it's really the way that I guess a naturopath looks at a case and how that is, it may have definite similarities to the way that a functional medicine practitioner looks at a case, but it's working on those principles of prevention's better than cure, treat the whole person, inclusive of their microbiome, in my opinion. And uh, first cause no harm, nature as teacher, and working with, I guess, nature and working with the body to achieve those results and not working against it.
Yeah, it seems like the big idea is to, as you said, do no harm, is to just search for natural remedies, preventions first, right? Before you would go to something more quote unquote drastic, I guess.
Mm, yes.
Okay, great. And how long have you owned the business? How long have you been in that realm?
Great question. 3 years, I think,
3
now.
years. Yeah,
Yeah.
congratulations.
Yeah. Thank you.
So, hoping to expand that one day and invite more folks in, or you're just very content to do it yourself there?
Yeah, I would love to have, I guess, more practitioners working in the space. So that's a very exciting, I guess, progression. Also doing more educational events. So having a place that people can, yeah, learn more about the microbiome and support themselves.
Yeah, fantastic. I'm sure it's nice to be guiding that process yourself, you know. So you're obviously an entrepreneur in addition to everything else.
Yeah.
I don't think it's the first time you've presented at the Naturopath and Herbalist Association of Australia, and this is just a couple of weeks ago, on this
Yes.
very topic, the oral microbiome and its relationship to systemic disease, again, which we really want to talk about today. Just start off with one question. What was your most striking finding?
Um, Gosh, how prevalent oral dysbiosis is, I think. Yeah.
Okay.
The outcome of oral dysbiosis, and we'll talk about that being a risk factor for a lot of systemic disease. And as somebody who, got into naturopathy for preventative healthcare,
Mm,
looking at that and going, wow, like, we talk so much about the gastrointestinal microbiome, which is amazing, but just walking into the oral microbiome and going, this needs to be talked about. Dysbiosis is prevalent, um, and yeah, needs to be addressed.
yeah. It seems like, and I don't know how common this knowledge is, the link between oral microbiome and you read about these things, and if you're learning at all, you think, well, everybody should know this, but that's not the case. And something so simple as brush your teeth, floss your teeth. When we first made connection, I mentioned in the email that I had early stage periodontal disease, which I think should probably more uh, specifically called gingivitis as opposed to periodontal disease. Does that sound about right?
There's I guess, a spectrum, and so gingivitis is down this end, severe periodontitis is down this end, and yeah, you can fall across that spectrum. Mm.
Yeah. Well, I was shocked. I went to a new dentist, and they do a little more, I guess, thoroughness. And I'm
Mm.
61. I've never had gingivitis before, but I also know I have gotten real lazy about flossing. I don't know if it's a guy thing or what it is, but I tell you what, after getting two super cleanings, which they say that really should have taken care of it. I am flossing every single day. So I learned my lesson, so to speak. But what,
I'm
what I
glad
hear
to
you
hear.
saying is too many people haven't learned this basic hygiene. Because I think the scary part is, right? Um, oh, what's the worst thing that can happen? My mouth gets sore. I get a toothache, et cetera, et cetera. We don't think about what we're talking about this morning. Yeah. So in that, and by the way, at any point, if you have something from that presentation or all your understanding of it, just jump in, and insert yourself, because I'm stumbling along and you're the expert. So,
Sure.
but
Well,
by all
I will.
means,
I'll take that invitation already,
yeah,
Rich.
please.
I looked up the prevalence of gingival disease in the United States. Obviously, I had the stats for Australia for my presentation, and periodontitis as well. And it's looking at 42% of adults in the US having periodontal
Whoa.
disease
Not just
and
not just gingivitis, but periodontal disease.
periodontal
Oh
disease.
my goodness. See, this is another one of those
Yeah,
moments I talked about.
shocking, absolutely shocking. And
Wow.
It was harder to get the data on gingival disease, but it was looking anywhere. I saw stats at 50%, and there was one publication that suggested 75%, which is gobsmacking.
Yeah,
Hmm.
that's a good Australian word. Thank you for
You're welcome.
that. That's awesome. You know, you wonder, I think my parents and grandparents' generation, my mom, my dad, my grandma all had dentures, and it seems to me that was like the norm. You know, I don't think I knew old people that didn't have dentures. So you would think, obviously, dental care has only gotten better in the last 50, 70 years, but you would think it would be a little better than it was a few generations ago. But I don't know if you saw any stats that show it a progression or regression of those things.
The incidence definitely goes up as you age, and worse for males as well, from what I saw. Yes. So
Because
I
we're
guess with
lazy and don't floss,
well,
apparently.
all dysbiosis, you're starting at one point and it's moving. So if that's not being, I guess, dealt with, and as we age, there are other risk factors that come into play as well, then that dysbiosis has an opportunity to keep progressing, and the outcomes of that progress as well.
Sure. And just to be clear, when you're using dysbiosis, you're referring specifically to the oral microbiome here, right?
In yes, in that case, yes.
Right,
I'll,
right.
I'll interchange it if I'm talking about gut dysbiosis. Yeah,
Sure, sure. Because that's normally the way I'm thinking. So
sure.
just want to clarify that. So you talked about prevalence of periodontal disease. What's the most prevalent systemic diseases that are arising out of the periodontal disease?
So I guess periodontal disease is a risk factor for other diseases, and they're not always one directional as well, which I think is pretty interesting. So cardiovascular disease has a lot of research around it as related to periodontal disease. Um, they're also linking neurodegenerative disease to changes to the oral microbiome. Certain gastrointestinal cancer risk factors can increase with dysbiosis in well, periodontal disease as well. Rheumatoid arthritis has been linked to the oral microbiome. And then also birth outcomes. Diabetes is one that has a bidirectional relationship. So your oral microbiome will affect your diabetes risk, but also having diabetes and having poor blood sugar control will actually be a contributor for oral dysbiosis. So you can get these links happening between the body and the oral cavity as well. And I think it's a really great opportunity as a naturopath to step into this space, because you're not just looking at the mouth, because it isn't staying in the mouth. How the body is functioning is affecting how the mouth is functioning, which is affecting what bacteria can grow in that space as well. So you're looking at how all of those links are coming together.
Is diabetes the main one that is bidirectional, or any of the others also bidirectional?
From what I can see, rheumatoid arthritis has a
Mm.
bidirectional relationship. The other one is sorry. The other one with a bidirectional relationship is obesity that will impact on the composition of the oral microbiome in a similar way to diabetes as well.
Okay. So out of those, and I appreciate the way you said, you know, it's a risk factor, right? It's not a direct cause and
Mm-hmm.
effect. It's a risk
Thank you.
factor.
Yeah.
Um, any of those though that are most have the most close association between or oral microbiome and systemic disease?
I wouldn't, I guess, classify them in that way, and I think
Okay.
that it's looking at the the compositional changes and going back to that scale of dysbiosis. You've got periodontal disease down this end, of oral dysbiosis. You've got gingival disease somewhere here. But if you go right back to here, there are things happening prior to getting to periodontal disease. I say we don't trip over and get dysbiosis. It's a progressive change in the composition of bacteria that can lead to that outcome. So if you're looking at, for example, the gut microbiome, we know that compositionally, if you're having high populations of inflammatory bacteria that are releasing inflammatory metabolites into the rest of the body, that is going to impact on, I guess, risk factors for certain diseases that have that inflammatory causation or part in the etiology. And if you're looking at the oral microbiome, if you're changing that relationship between or the composition of oral microbes from a anti-inflammatory to a pro-inflammatory immune activated state, then you are opening up that risk factor box for all of those lifestyle diseases.
Yes, thank you. And I just want to ask a question about dysbiosis, as I said before. Again, I'm so used to thinking of it in the gut microbiome, and I understand the colonocytes and the tight junctions are open up, but I've also heard about leaky gums. So is it that essentially the same thing? It's the harmful bacteria and other things are leaking into the bloodstream from the mouth?
Yeah, so our beneficial bacteria in our mouth will modulate how the gums are reacting. So they will help to signal for those gap junctions to stay nice and tight. They're actively managing the space, making sure everything's okay. So if you have a decrease in your abundance of those bacteria, you're losing that capacity for them to be managing that gum space. That often is associated with an increase in the pathogenic. I do this because everything is, I guess, dose dependent,
Yep.
bacteria, and that will then, I guess, increase that inflammation of the gums. So with the oral microbiome systemic health link, you've got a few different mechanisms. So there's the translocation of bacteria through the gums into the bloodstream. There's swallowing the bacteria through the digestive system. And there's also that activation of inflammation and the immune response that can impact on systemic health outcomes as well.
Mm-hmm. So again, with dysbiosis, is it also the same because you're talking about a single layer of epithelial cells in the colon? Uh, uh, is the leaky part in between epithelial cells then in the mouth? So it's really
Yes.
almost identical except for the types of specific types of cells.
Mm.
Interesting. Okay, did not know that. Yeah. Um, so to have the beginnings of leaky gums, oral dysbiosis, you're essentially already in gingivitis stage. Is that correct? Okay. Okay. All right. Yeah, just trying to understand. And it's also surprising. You talk about, and I was reading as well about swallowing all these harmful bacteria. As many people say, it's all just one open system, right? One long pipe, essentially. I've done a lot of gut tests on myself over the past several years, and I've never actually searched for oral bacteria, predominantly oral bacteria. I imagine they're there, but I haven't seen anything that looked alarming. So is that a pretty common mechanism then through swallowing, you're saying?
So you swallow between half a litre and a litre and a half of saliva every day. And
Yum.
yes, it does. Yum. It allows that translocation of bacteria through the digestive system. Um, in relation to picking up oral microbes in the colonic ecosystem, I have seen it come through in testing. But it doesn't necessarily mean if it's not moving through your digestive system that it's not still a problem. So our oral cavity is a highly diverse environment, and it's, I guess, the second most diverse microbial community in our bodies.
Mm.
So just the composition of bacteria here and the capacity for them to translocate, like I said, via the blood as well, or via sending out vesicles. So some bacteria such as Porphyromonas gingivalis can send out these little vesicles with their genetic material in them that can then go and impact on other areas of the body. And that's part of the oral microbiome cognitive decline dementia risk. They've found ginger pains, which are those vesicles deposited in the brain. And so, yes, swallowing the microbiome can impact on your digestive microbial exposure, and that's definitely going to have that's going to impact on when we're looking at the risk of colorectal cancer, pancreatic cancer, and other GI cancers, as well as inflammatory bowel disease. It's going to have an impact via those mechanisms through swallowing, but the composition in the mouth as a standalone also has quite a significant effect.
Got it. When you talk about the vesicles, are these like a cyst-like thing in the brain that actually contains the P. gingivalis, or what is a vesicle?
The vesicles get sent out from the microbe, and so I've been trying to think of the best way to describe these. They're like little mini spaceships from like the main spaceship. In the case of the Porphyromonas gingivalis, it's the ginger pains that they have found, which is a microbial metabolite that they produce that then increases plaque formation in the brain and neurodegeneration. So bacteria can also translocate in plaque. So with that progression of, I guess, oral dysbiosis, you're getting an accumulation of plaque in the mouth. And so we know that plaque on the teeth, we can't shed our teeth, so the plaque accumulates, and the thickness of that plaque can allow and thinking of plaque as biofilm, the thickness of that plaque slash biofilm accumulates and creates an anaerobic space. And so a lot of the bacteria that are in that pathogenic category are your anaerobes. And so you're creating a space that they like to live. And so that, when it's mature, can break off. And then you've got this little bit of biofilm that has, say, P. gingivalis, it might have actinomyces, it might have Fusobacterium nucleatum, and that can travel through the digestive system, but it's nice and protected in its little structure, and it can make it harder for the body to then try and eliminate it. So yes, vesicles, but also I've segued a little bit. Sorry, Rich.
Yeah, it's
but
good.
also breaking of biofilm. And that goes back to what you were saying before about flossing your teeth and dental care. Essentially, we're breaking up that biofilm. So we're not allowing that anaerobic space to proliferate and allow a habitat for those bacteria to live in our mouths. And so brushing your teeth, you're getting about 60% reduction in biofilm. Flossing, you're getting the other 40. So if you haven't been flossing, you're missing out every day on breaking up 40% of that biofilm. And if you think that in that biofilm, you've got potentially P. gingivalis sitting in there, and then it's releasing its little vesicles. These little spaceships are coming out of that and then going around your body, either through the bloodstream or through the digestive tract. You can get really motivated to floss when you start to think about that as what's going on in the background.
For sure. Yeah. And the real motivation comes, of course, when you, but I appreciate that 40%. That's striking. I did not know that. I'll have to try to impress my dental hygienist next time I'm in the dentist. I must be a weird patient because I ask unusual questions when I'm in the dental chair, and I'll ask even more unusual questions next time. But now I lost my train of thought. But obviously that's frightening, 40%, but even more so, I might get, or this could greatly increase my risk for Alzheimer's. And that's personally, my mom was diagnosed at age 49, so I know there's probably an APOE4 gene in me somewhere. So, like dummy me, but again, learning my lesson. Yeah. And that was striking. Just a patient experience. Again, they were extra thorough and really probing deep, into the gums. And I was like, I feel that. I feel that. I had not felt that before. So
Mm.
I experienced leaky gums in real time there for sure. Yeah. You mentioned P. gingivalis a few times. Is that probably the most common, again, quote unquote, pathogenic bacteria in the oral microbiome?
It's had a lot of research done on it, which makes it an easy one to speak of because we have that data. Um, Fusobacterium nucleatum also has a lot of information relating it to different disease states as well. And then Aggregatibacter actinomyces concomitans. I always
Yikes.
struggle with that one. It's a big in, but
Hmm.
that one also has a relationship with systemic disease as well. So that's another one that I would be looking at.
Gotcha. Now, before you mentioned, if I'm not hearing you right or not, you said ginger pain, like Pain, or no?
Gingipans, ginger pains.
Ah, okay. So that is the metabolite, like a lipopolysaccharide type thing.
Yeah.
Okay, so
Yes.
would that be the oral microbiome's version of LPS, sort of?
Well, the oral microbiome has LPS as well.
Sure.
If anywhere you've got a lot of gram-negative bacteria, which going back to that spectrum of oral dysbiosis, if you're getting an increase in gram-negative bacteria, you're getting an increase in inflammation, increasing permeability of tissue, and you can see how that, yeah, is progressing. But yes, in P. gingivalis, the ginger pains are a part of their, I guess, disease risk.
And I did not look this up. P. gingivalis, gram negative or gram positive?
Gram negative, I believe, but yeah, I've just had a mental blank on that as well.
Sure. Well, most of the bad guys tend to be,
Yeah,
So with that,
and anaerobe.
you're probably getting some LPS and this ginger pains from that.
Yeah, with anaerobes or gram negative. Yeah, and so looking at the composition of the oral microbiome, but also when you've got a lot of plaque formation, that capacity for that ecosystem to be allowing more bacterial metabolites that shouldn't be there.
Hmm. Do you know if let's say I've got leaky gut and there's systemic inflammation, is that a risk factor for oral dysbiosis, just general inflammation?
That's a good question. I haven't come across that, I
Hmm.
guess, in the research. I guess with with gut dysbiosis and intestinal permeability, you can then look at the relationship between that and the oral immune system. And I think it's a really good time to segue into saliva. I have got really excited about saliva as a biological fluid because it has a great modulating effect on your oral ecosystem. So the oral ecosystem, because it is exposed to microbes all of the time from food we eat and the environment that we live in, it has this homeostatic ability, to self-right again. It's not particularly vulnerable to dysbiosis because of modulating factors, and saliva plays a big role in that. So in that half a litre to a litre and a half of saliva you're producing every day, the saliva itself has compounds and immune factors that will then help to fight or bring down those pathogenic bacteria in your mouth. So if you're looking at systemic health and going, okay, this person's immune system isn't working too well, then you would, from that holistic view on oral care, go, oh, is that then impacting on their oral immunity? And if their oral immunity is decreasing, how is that impacting on their capacity to maintain oral eubiosis through that mechanism? The oral ecosystem, so the saliva also provides nutrients, so prebiotic factors to feed up your beneficial bacteria, and it manages the pH of the environment as well. So we know that pH will manage what lives in a space, whether that's your oral cavity or your colon. It's going to impact what microbes grow there. So if you've had somebody who has perhaps has had an eating disorder or has malnutrition through poor absorption of nutrients, then you're looking at how that is impacting on the nutrients that are being given to their oral microbes to then have that, that balancing effect in the mouth.
And I know in the colon, I assume in the oral microbiome, the more acidic it is, the more of an it's difficult for the gram-negative, the pro-inflammatory bacteria to exist, right? The more acidic it gets. So the good. So and is there an equivalent of lactic acid producing bacteria in the mouth? Like how does it lower the pH?
So the minerals in your saliva will help to,
Okay.
yeah. So you've got alkalizing minerals in your saliva, and a normal pH of the mouth ranges from 6.2 to 7.6. So it's more on the alkaline, or neutral, I should say, more on the neutral
Sure.
side.
But do you want it to be more acidic or not necessarily? It's not like the gut in that regard.
No,
Ah,
different environments, different microbes, different pHs.
sure,
Yeah.
sure.
So
Okay.
yeah.
So really, yeah, your saliva, which makes sense, is similar to your pH over the rest of your blood and the rest of your body.
Your saliva, and I guess you're looking at what else is in that saliva as well, which I think, yeah, isn't thought about when you think of saliva. And then when you're thinking about maintaining a healthy oral ecosystem, what's going on with your saliva? Are you anxious, and that's causing a reduction in saliva production, which means that you're not being exposed to those antimicrobial compounds. You're not being exposed to those prebiotic nutrients. When you're brushing your teeth, you're allowing the saliva to get in deeper in those crevices, and that saliva contains those antimicrobial compounds to help to manage that ecosystem. So it's looking at how to support the body to do what the body does. And when you're looking at oral dysbiosis or periodontal disease, I believe that you also need to be looking at what's going on with that person's saliva, the quality of it and the quantity of it.
And there are easier ways to test
The
that.
saliva,
Yeah.
um, not that
For
I'm
the
aware of.
minerals and nutrients and so forth. Yeah.
Not that I'm aware of. That
Okay.
goes back to case taking and sitting down with somebody, looking at their diet, looking at their lifestyle factors. There are medications that impact on salivary flow. There are diseases that can impact on salivary flow. So you're looking at all of those little pieces of the puzzle and how that's impacting on that individual.
Yeah, fascinating. Last 3 or 4 years, I've been practicing exclusive nose breathing. Unless I'm talking or eating or drinking, breathe through my nose. That includes all exercise. And then my wife and I tape our mouth at night. So I'm assuming that's maintaining the beneficial saliva in your mouth and you're not getting dry mouth because you're breathing through your mouth.
Yeah, I've had some interesting conversations with colleagues about people, yeah, sleeping with their mouth open and what does that mean for their oral ecosystem.
Is that anything you covered in your seminar, mouth taping, or does that come up?
No, I think with mouth taping, I I'm looking at, I guess, other factors as well, such as if there's any allergies in the nose and that's contributing to that. And then there are practitioners that work more closely with like tongue positioning and the way that, yeah, all of those habits are formed, which I would be referring to as opposed to doing myself.
Sure. Yeah. Yeah. I had no idea how. I mean, you get real excited about saliva, which is cool. You help us learn, but tongue position, and whether you release a tongue tie or not, and it has such massive, or at least potentially massive implications. Things I never really understood before. Yeah.
Yeah.
You mentioned prebiotics in the saliva, which is super cool. I changed my gut only through prebiotics. I didn't take
Hmm.
a probiotic until at least 3 years into my gut health journey. But are there other prebiotics or probiotics that we can take that would benefit the saliva or the oral microbiome?
So one prebiotic factor that comes through saliva is dietary nitrates. And I think this is another really exciting part of the oral ecosystem. So when you're eating dietary nitrates through your green leafy vegetables and your beets, for example, you're ingesting the nitrate. It's then coming back through into your salivary glands as nitrate that then gets secreted. So I think it's about 30% will then come through your salivary glands. That gets secreted into your oral cavity, and you've got nitrate reducing bacteria in your mouth. So they will turn the nitrate to nitrite, which is the precursor for nitric oxide. And so the dietary nitric oxide pathway is dependent on bacteria in your oral cavity to make that happen. So when you're looking at cardiovascular disease and especially hypertension, looking at the capacity of the oral ecosystem to work that dietary nitrate to nitric oxide pathway is one factor you would look at. But the dietary nitrate actually helps to feed up beneficial bacteria in your mouth via that process. We also know that polyphenols, which similarly to your gastrointestinal microbiome, are fantastic for feeding up your oral ecosystem
Mm.
um, and promoting beneficial bacteria in the mouth. And the Mediterranean diet has good research for supporting a healthy oral microbiome. So I would be looking at those as prebiotic foods. And I guess when it comes to probiotics, there are strains that have shown to be beneficial in the oral ecosystem and in managing oral dysbiosis. But I also am very apprehensive about just going ahead and going, oh, you've got, periodontal disease, therefore you should take this probiotic, tick, you'll be fine. Because as I mentioned, your immune system status, your nutrient status, your salivary flow, all of these factors, what's going on with your blood sugar, all of these factors are going to be impacting on the composition of your oral ecosystem. And to be treating somebody holistically, I don't feel that you can miss all of those pieces of the puzzle in managing that dysbiosis. So yes, absolutely, there are probiotic strains. There are also herbs that have shown to have great modulating factors on the ecosystem, and some of those have even been researched against chlorhexidine, which is used a lot in the management of periodontal disease as an antimicrobial. And there's been some really great results there as well.
Yeah, that's the naturopath in you speaking, right?
Absolutely.
Our family worked with someone that you know quite well. You worked with before, and or many times, and I interpreted her process as, I would say, conservative, or slow, etc. But then once I understood where she was heading, it made absolutely perfect sense. Yeah, yeah.
Mm.
But then in the case of some family members, some infants, um, this naturopath went to what for her was more of an extreme solution because nothing else seemed to work. But I really appreciated that process that you're describing, because it's everything works together. It's multifactorial, et cetera. Yeah.
And there's so much we don't know about the ecosystem as well. So going back to the oral microbiome, there are, like 700 species of, bacteria, fungi, archaea. You've got protozoa in there. We know a lot about the bacterial side of things, but we don't understand the interplay between all of those things as well. So I think it's also respecting the fact that we don't know so much about that ecosystem and going in with interventions that are, I guess, health promoting and have, and I spoke of this a lot in my presentation, a strong traditional use. So we know chamomile. We've been using that as a herb for a very long time. That has amazing antimicrobial effects against P. gingivalis, for example, and will help to balance the oral ecosystem. It helps to reduce inflammation. So getting somebody to drink a cup of chamomile tea every day, it seems really nearly inert in being a remedy for a lot of people that are used to taking, I guess, quite either strong antimicrobials or the latest cutting edge probiotic. But if it works and we know that it has such a strong traditional use, I think it's a really great place to start.
Yeah, fascinating. It helps you sleep then too, right?
Win,
Chamomile
win,
tea.
win. Yeah.
Yeah, for sure. You mentioned the dietary nitrites then produce nitric oxide. That's also the benefit of nose breathing is you increase your nitric oxide. So I would think that would also be in addition to the fact that your mouth is not drying out at night, would add to the nitric oxide in the saliva, maybe?
Um, I would have to look at what bacteria up your nose impact on the nitric oxide pathway. I think that would be, part of answering that question, and I haven't looked at that yet.
Yeah, and I know enough to be dangerous, on that question. So I appreciate that. I love that you mentioned the polyphenols. I consume a lot of cranberry extract powder, which, as far as I've seen, has about as much polyphenols as anything else I could find, except for some weird spice, which you're not going to eat much of. So that's encouraging because also, again, there's prebiotics in there in addition to the polyphenols. So awesome. We're talking a lot about best oral hygiene prevention. Brushing, you said 60% of biofilm. Flossing is 40%. And chamomile tea, the polyphenols, all of those things. Any bigger pieces we might be missing in terms of prevention?
I would say thinking about your environment. So the obviously smoking and vaping are incredibly dysbiotic. And if you're looking at risk factors for oral dysbiosis, say one course of antibiotics might move you 25% towards dysbiosis, but that's smoking and vaping and diabetes. They're all much more So they're much higher on their dysbiotic effect on the oral ecosystem. So if you're around smokers and you're passive smoking, or you're walking down the street behind a vapor, I would be myself moving to more clean air. But there are environmental pollutants as well that alter the oral microbial composition. So it kind of goes into that, where we're living and what we're doing with our environment. I know I'm opening the box on quite a large subject, but how that is then coming back to just those little shifts happening all of the time. So if you're living or exposed to secondhand smoke, if you've got airborne particulate matter that's higher in your environment, they would be risk factors for oral dysbiosis as well. I've forgotten the rest of your question. Sorry, Rich. I've gone on a bit of a
Oh, no.
tangent there.
Very, very helpful. What I'm hearing you say is, if you want a healthy heart, live a healthy lifestyle. If you want a healthy mouth, live a healthy lifestyle. Is it as pretty much as simple as that?
Essentially, we're learning all of these amazing things about the microbiome, but I find that it always comes back to the same principles. We're learning these really fancy ways to go to bed on time and eat our greens and eat our vegetables, go and spend time in nature, don't be stressed. All of those things will affect not only the composition of bacteria in your mouth, but how your whole system is functioning, because we know that your whole system needs to be functioning well for your oral cavity to be functioning well, because of that bidirectional relationship and our dependence on all of those factors coming in through our saliva as well.
Yeah, I'm sure you're excited for the future, just more research and learning more. For example, maybe in 5 years, we'll be able to actually test the saliva and see it. Anything can happen because it seems to be happening. So pretty exciting. Anything out in the near or further future that you heard about and are excited about?
In relation to the oral microbiome, or
Yeah, anything for that matter, but if it happens to overlap with the oral microbiome.
oh gosh, there's lots of things.
Sorry, put you on the spot there.
No, that's okay. Whilst I was doing my research for the talk at the Naturopathic Symposium, I was reading a lot about pancreatic cancer, because the oral microbiome can impact on risk factors for pancreatic cancer. And it's a very, the prognosis is very poor for pancreatic cancer because it gets picked up quite late. And there's some really great research looking at the relationship between oral microbes and pancreatic cancer risk, and the capacity to also test the saliva for risk factors as well. So that's a pretty exciting space that I feel very very glad that that is happening, to move that I guess that diagnosis earlier for a lot of people as well. And going to the dentist, and for naturopaths and clinicians all over the world to have oral health on their radar, that if you're seeing somebody and they have periodontal disease, which unfortunately, if you're looking at the stats, you're like, wow, okay. They perhaps used to smoke, or they've had recurrent pancreatitis, is there that capacity to move them into getting further screening done? And I think that is getting researched now, which would be fantastic to see.
Absolutely. I had a year and a half ago, a childhood friend die of that horrible disease. And everything I've ever read, like there doesn't seem to be a lot of clear association or causation. So to hear that there's something that can be done there potentially is really encouraging. Yeah. In addition to all the other benefits, of course, that would come out of that. Yeah. You familiar much with hydroxyapatite toothpaste? I started using that a few months ago, and and everybody says that's what you should be using.
Yeah, I had a look into it. It's not one that I use in my practice. It's got a lot of great research around it for I guess helping to prevent the adhesion of bacteria and helping with mineralization. But I think that it's when you're looking at like taking that step back and going, okay, what are we trying to achieve here in periodontal disease? You're wanting to reduce biofilm, you're wanting to shift the composition of bacteria, and you're wanting to decrease inflammation. I don't think it covers all of those things, but it can cover part of that picture. So I think if people are using that, thinking about using that in conjunction with other things to be modulating the ecosystem at the same time.
Totally makes sense. Yeah, go get the foundations first, and then consider other things on it. Yeah, that makes sense. So how frightened should we be, right? All these terrible statistics, the prevalence of periodontal disease, all the strong links to all sorts of systemic disease. I mean, that is part of it, right? We do want to sort of warn people, right? Scare them a little bit. Is that fair?
Um,
Brush your teeth or you will die, your mother says to you.
I think education is an incredibly powerful tool for making change. And leading into my conference, the amount of conversations I've had with people that has resulted in them coming back to me over the last couple of weeks saying, "Oh, I went to the dentist the other day," and they hadn't been like the amount of people that haven't been to the dentist in years is really high. And you can look up the statistics for that as well. But going to the dentist allows that breaking down of all of that biofilm in your mouth. It's taking away those spaces for the anaerobic bacteria to live, which are the ones that we know are more problematic. But it's also allowing your saliva and all of those beautiful immune aspects of your saliva, all of those nutrients for all of your beneficial bacteria to get into those spaces as well. So definitely, yeah, it's really important to go and look after your oral health and think about what's happening with it, but also think about how you're interacting with other people, the way that we interact with babies and young people. We're setting them up with their oral microbiomes in that first year of life. So if you're somebody who has poor oral health, which you may know through periodontal disease or through a lot of dental caries, or you may have quite bad halitosis, which would indicate more sulfur containing microbes in your mouth. Don't put saliva in a baby's mouth. Don't go up and give them a big sloppy kiss or transfer your food to them. I think that yes, we need to be thinking about this for ourselves, but we need to be thinking about it for our population health as well. So going back to the scary factors, yeah, if you're not looking after your oral health, your risk factor for disease is, going up. If you're not managing your oral health while it's good, you're going across that scale towards bad. And like you said, once you get right up this end and you've got periodontal pockets, you've got these new deep anaerobic spaces that are hard to get to that are allowing that growth of bacteria and that interaction with your immune system and that translocation into your blood. Once you get to that stage, it's much harder to come back. You can't undo the damage when it's done, but you can prevent it from happening. So definitely support your oral health while it's good, and actively support your health in general because your oral health is going to be dependent on it as well. Was that
I think that's a
scary
really,
enough?
oh, not quite enough. But
All right.
I'm gonna floss tonight anyway. Important point though about the oh, what were you saying? Um, oh man. Oh, it's gone. It's gone. Oh well. Uh, I did have a question from before though. I thought I had read this at one point when you're talking about the dental plaque, which is the biofilm,
Hmm.
that there's association between oral plaque and arterial plaque, arthrosclerosis, atherosclerotic plaque. Is that accurate?
Yeah, if you look through the mechanisms of, I guess, yeah, it would be accurate in the sense that oral dysbiosis is a risk factor for plaque formation in the body. So plaque
But they're not the
formation in the
same
mouth,
bacteria necessarily that are translocating to the
not in my
arteries.
understanding. It's
Okay.
more of the yeah, the making of that plaque through the inflammatory aspect as well.
Same as everything else we're talking about. Okay, got it. Got it. I wasn't sure.
Mm.
Is there anything that we missed that you'd love to share?
One herb that I think is amazing at supporting the oral microbiome through a few different mechanisms is Rosella. Have you heard of Rosella or
No,
hibiscus
never,
as a
never.
tea?
Mm-mm.
Um, it's high in polyphenols. You might want to add it in alongside your cranberry powder. But it's a tea that has been used, I guess, for a long time. Once again, strong traditional use, and it supports cardiovascular metabolic outcomes. And so, drinking hibiscus at, I guess, a higher dose is also shown to decrease blood pressure, which I find really interesting with the oral nitrate side of things and its capacity to support the oral microbiome. I think there's more studies there that could be quite interesting. But Rosella helps with those metabolic factors. So we know that uh, dysregulated blood glucose is a risk factor for oral dysbiosis. So if you can also add something that's supporting your blood glucose, you're adding polyphenols, which have shown to improve the composition of bacteria in the mouth, both through increasing the beneficial bacteria, decreasing the pathogenic bacteria. Um, and it has, I guess, research showing that it does reduce populations of P. gingivalis, as well as the Actinomyces streptococcus mutans, which we know is associated with dental caries. So it's got some really great broad action in the oral cavity and systemic health outcomes as well.
And thank you for that. Can you give us the name of the herb again?
So it's Hibiscus subderiffa or Rosella.
Oh,
Um,
so they are the same thing.
Yeah, that's the
Oh,
botanical name and the common name.
okay. Hibiscus, I do know. Okay, now
Yeah,
I got it.
yeah.
Fantastic. Well, I'm gonna be done with you. I'm gonna make some tea. Obviously, it'll be the
Yes.
next thing I need to do. My wife is the tea drinker. I make kombucha, so I drink tea that way. Hibiscus kombucha, that should work,
That would
right?
be a great idea. And maybe a
Yeah,
little bit of chamomile in there as well,
sure,
with
sure.
a
And I,
side of green leafy vegetables.
exactly. Yeah. So I like to end all podcasts, I call this the Resilient Biome podcast. And I think I think a naturopath, resiliency would be a drum you would beat constantly, right? That's the goal. So is there anything in all of your work as a practitioner that you would say, hey, this would be my top recommendation to have resilient everything, health?
Yeah, that's a really big question, and I like it. And I've been, yeah, thinking about that as well. Resilient microbiome. I think that my take on that is that we're not separate. I think we have this idea that our microbiome is our microbiome, and to a lot of an extent it is, but we share our microbiomes all of the time. The air around us has a microbiome, the environment we're in has a microbiome, the food that we're eating has a microbiome. And so, for our microbiome to thrive, the microbiome of the world needs to thrive. And I think that taking our focus outwards as well as inwards is really important, because I feel that we're going to get to a point where we can only take so many things to manage our own microbiomes when the microbiome of the world is, moving towards dysbiosis. We're going to go with it. So yeah, I guess that would be my take. A resilient microbiome is dependent on the microbiome around us as well, and to not forget about that in the process of supporting our own microbiome.
That's a fantastic answer. Very, very global in scale for sure. Yeah.
Yeah, and
My,
we should get scared about that. That's, if we're going to throw scare factors out there, it's when you start looking into that, it's quite scary. Mm.
yeah, for sure. This is not my full-time gig running this podcast. I'm a pastor. I love that job. And I constantly see, especially through the human body, but anything in creation, God's handiwork of creation. And you're especially focusing, I think, on symbiosis. I mean, our whole bodies, is just continual symbiotic relationships. I mean, the simple thing, right? With one of the first things we learn about in the gut microbiome are the healthy metabolites that in our immune system. So, but I don't think of that's very challenging a global symbiosis. So very cool, great answer there. So
Thank you.
yeah. Well, I don't know if you've had your coffee or breakfast yet, but you carved out a lot of time for us early in the morning there. So Jessica, this has been very helpful. I actually have been looking for months for a guest on the oral microbiome. So excited you could be with us, and so extremely helpful. Thank you.
Thank you for having me. And yeah, thank you for taking on the naturopathic approach to managing the oral microbiome as well.
Excellent. I wish you the best in the Cellium business and all the help you're giving to people.
Thank you so much.
All right. Yeah. Take care.
Take care.